the body scan. First of all, find somewhere comfortable. Most people do this meditation lying down on the floor. Perhaps lie on a blanket with a pillow underneath your head. You may prefer to have your legs stretched out, or you may want to bend your legs at the knee and have your feet on the floor. Just make yourself comfortable and choose a position that feels the best for you. This meditation is not about trying to feel relaxed, but that may happen. This meditation is about bringing an awareness to the present moment, bringing an awareness to how your body feels right now. So first of all, we'll just tune in to the sounds that are around you at the moment. Any sounds within the room. Perhaps not trying to name or establish what these sounds are. Perhaps just tune in to the quality of the sounds and notice any thoughts you may be having. Now moving your attention to sounds that are still within your environment, but are outside the room you're in. Maybe sounds within the rest of the building that you're in, or in another room or corridor nearby. Perhaps you can hear other people or movement. Perhaps you can hear sounds from outside. Weather, such as rain or wind, or traffic moving past the room you're in. Just notice the texture of those sounds and any thoughts or feelings you may be having at this moment. Now we're going to move our attention to the breath. Just noticing the air moving in through the nostrils and the nose into the throat and into the upper chest and the tummy. Perhaps just noticing where you feel the breath the most. If you feel it around the nostrils or nose, in your throat or in the chest or the diaphragm area. Just bringing more of a focus to that area, that region where you feel the breath. Bringing an awareness to the sensations of the breath at that place in your body. Just letting the breath be, letting it come in, filling your lungs, allowing your rib cage to move up and out, your diaphragm to move down, and your tummy to move out as the breath fills your lungs and your body. Noticing the movements and following the breath out as the tummy moves back in, the diaphragm goes back to its resting position, and the lungs deflate slightly, and the ribs move back down and back in. Following the breath out through the throat, through the nose, and out through the nostrils. Bringing your attention back to where, at what point you feel the breath at its most. Noticing where that is. Perhaps using this as an anchor point to anchor your awareness if you should find that your mind wanders off to a different place. Noticing when that happens and gently bringing your awareness back to that anchor point, bringing it back again and sometimes again. Perhaps just being kind to yourself. If you're noticing your mind wanders, congratulating yourself that you've noticed it's wandered and bringing your awareness back to the breath and to the anchor point. Moving from the breath, moving your awareness now down the body, down the left leg, through the ankle and into your foot. Notice the temperature of your feet, noticing any sensations in the toes, in the balls of your feet, any sensations in the heels of your feet, perhaps around the top of your foot. Perhaps there's tingling. Perhaps there's a slight change in temperature to the rest of your body. Feels cooler or warmer. Just noticing how that left foot feels. Feeling pressure of the floor, perhaps on the sole of the foot or the heel of the foot, depending on how you've positioned your legs. It might be that you find you have no sensation there. It's a sort of neutral feeling. That's also okay. Moving your awareness from the left foot up through the ankle, round the ankle, tuning into any slight fluctuations or variations, shall we say, in the sensations there. Just noticing. If you find your mind is wandering, just gently bring your mind back to the breath, to the anchor point I spoke of earlier. Bringing an awareness now up through the calf muscle and the shin, noticing any differences between the front and the back of this part of your leg. Perhaps the feel of clothes on your skin. Again, perhaps it's a neutral feel. Moving your awareness up to that big joint, the knee joint. Noticing the kneecap and any sensation here. Perhaps pulsating or tingling. Maybe aching. Noticing any thoughts you may have around this joint. Desire to move or slightly adjust your position. Just moving round the back of the knee now, to the softer part of the knee. Just noticing any sensations there, change in temperature or the feel of clothes or material. Now moving your awareness up the leg through that big thigh muscle. Noticing any tension or areas of strain, or not trying to change anything. Just noticing if there is anything there that you may feel you become more aware of by paying attention to it in this present moment. Moving your attention now up through the hip muscle into the groin area and the pelvic area. Just coming back to the breath. Just tuning back in with the breath and what's happening with the breath in the body right now. turning towards that anchor where you feel the breath the most. And just spending a moment here, following the movement of the breath. Now bringing your awareness to your right leg, moving your attention from the breath and the anchor point down through your torso, through your pelvis, down through the right leg and into the right foot. Bringing an awareness to how your toes feel, whether there's any difference between the sensations in your big toe and your middle toes and your little toe. Perhaps there's nothing. Perhaps there's tingling. Perhaps you can feel one or two toes, the others are neutral. Just noticing the sensations there. Noticing any sensations in the ball of your foot. And the sole and the heel of your foot. Feeling where the foot, or parts of the foot, make contact with the ground. Noticing any pressure on the skin. Bringing your attention now round to the top of the foot. Noticing whether there's more sensation here or less than the underneath of your foot. Noticing any thoughts you may be having right now. If your mind is wandering, gently bringing it back to the practice. Just guiding your mind back to where we are now in this practice. And staying now with the top of the foot and following up through to the ankle. Perhaps just tuning in to the bony parts on either side of the ankle and how these feel. Perhaps you notice nothing. Perhaps there's some sensations here that you're now aware of. Moving your attention up through the leg, the calf muscle and the shin. Up to that right knee joint now. Following the kneecap round, that round circular kneecap, protecting this joint. Just turning towards that kneecap now and noticing anything. At this point in your body. Checking in with the temperature of this part of the body or any sensation. You're moving your awareness up the leg through that big thigh muscle and around the front of the leg. Again, noticing sensations, any aching, any areas of tension or perhaps heaviness. Tightness. Moving your attention now up into that pelvic area that gives stability to the body, pelvic girdle. Taking your awareness now around the back of the pelvis into your back, noticing the lower back where it may be resting on the floor, what sort of pressure or touch there is between your back and the surface of the floor or the blanket you might be lying on. Moving your attention up through your back to the middle of your back, following the spine up, feeling any sensations in the muscles between the ribs, between the spine and the main areas of your body. Moving up into the shoulder blades, noticing any aches or areas of tension or tightness. Noticing where the shoulders make contact with the floor and how that feels. If your mind is wandering, just gently bring it back to the breath. Notice the breath going in and out. Leaving the back now and bringing your attention round to the tummy area. Soft, almost vulnerable area that protects some of the most important organs. Just noticing any movement in the tummy, any tightening of clothes as you breathe in. Your tummy moves down as your lungs fill with air. And then any loosening of clothes as you breathe out. Noticing the ribs moving up and out as you breathe in, the chest rising and falling as you breathe out. Following this movement. Making any judgments or trying to change things. Just noticing what is happening in your body right now. Moving your attention into your left arm, down into your hand. Noticing where it is resting. Noticing whether your hand is touching the floor or the blanket. Perhaps it's touching part of your leg or your body. Noticing the position of your fingers. Becoming aware of the temperature of your left hand and your fingers. Any changes in sensations. Tingling or even pins and needles. Noticing any thoughts or desire to move, change the position of your hand. Allowing your hand just to be. Moving your awareness now through the arm into the elbow and that joint. Noticing whether the elbow is bent, how much, any sensations here at this place in your body. Now bringing your attention across into your right arm, moving it down through the arm into the hand. Noticing the fingers, position of the fingers, and if there's sensation in the fingers and the thumb, whether there's any different sensations in different fingers, or if some are neutral. Noticing the temperature of your hand. Noticing any thoughts around how your hand feels, any desire to change something, any urges to do something. Moving your awareness now up your arm to your elbow. Noticing this joint, how it feels. If your mind has wandered, just gently bring it back to the breath, following it in and out. Now bringing an awareness to your neck, your face, noticing the jaw, noticing any tension around the jaw, not to change it, not to try and feel more relaxed, just noticing if there's anything there that feels tight, achy, around the jaw and the lower face. Noticing the tongue, where it is in the mouth. Any sensations in the tongue, any tightness. Noticing where that might be, at the back or middle of the tongue. Perhaps it's at the tip. Noticing the position of the tongue in the mouth. The tongue on the floor of the mouth, or is part of it up or arched? Noticing the muscles around the mouth, if they're holding any tightness or tension there. Is there any aching in the face? Bringing an awareness to the muscles that go around the eyes. Again, if there's any tightness, or perhaps it feels loose and soft. Just becoming aware of the muscles in the face and how they feel. Now coming back to the breath, following it in and out of the body. Noticing the quality of the breath, the movement of the breath through the body. Noticing the movement of the breath not just through the nose and the throat and the lungs and the tummy, but perhaps also the breath moving through the body, the whole body. Staying with that just for one moment. Just starting to become aware of the sounds in the room again around you. Just tuning into those sounds. Moving your awareness outside of your immediate environment into other parts of the room or the building that you're in now. Sounds outside the room, in the hallway or corridor, in other rooms, and perhaps another floor. Perhaps tuning into sounds that are outside. People walking, buses, cars, any horns beeping. Just bringing an awareness now to sounds around you. Gently opening your eyes, allowing the light back in. Congratulating yourself on practicing the body scan today and allowing yourself a moment before you move forward into your day.